In this video, we'll learn about polycystic ovarian syndrome. Polycystic ovarian syndrome. Poly means multiple, cystic means there are cysts pertaining to, and ovary syndrome means there are some other symptoms and conditions involved in this, and there are cystic pouches in the ovaries. Most common endocrinological disorder in reproductive age in women worldwide. Its prevalence is 5 to 15%. It's a multifactorial disease. It involves excess production of androgens, male sex hormones, means testosterone involvement is increased rather than estrogen and progesterone. That causes functional ovarian hyperandrogenism. There is increased androgens and altered gonadotrophin levels that it erupts the ovulation process. There are few risk factors associated with it that may be genetically present. Monozygous twins with PCOS, first degree relative with PCOS. Second is environmental influences. Third one is obesity, that may be pre-pubertal or at the puberty level. Early onset menarche. Large or small for gestational age. To the clinical features of PCOS that involve, most important is menstrual irregularity. There is irregular periods, onset, and chronic in ovulation. Hyperandrogenism means androgen hormones increases that causes hirsutism and acne vulgaris. And third one is, and there is lot of occurrence of polycystic ovaries. And the other feature is overweight and obesity. This is the most common reason. And obesity is the leading cause of polycystic ovarian syndromes. Now let's come to the associated comorbidities. First one is obesity and metabolic syndrome, and this involves diabetes type 2, as there is development of insulin resistance in the body that leads to diabetes and increased body weight. And the most common issue that females face is the infertility and anovulation that is directly related with irregular periods, multiple cysts in the ovaries. The other associated feature is obstructive sleep apnea, and the most first of all is beta HCG leading to pregnancy, medications like androgenic steroids, dopamine antagonists, TSH leading to thyroid disease, prolactin, FSH and LH E2 test for hypogonadotrophic and hypogonadism. 17 OH progesterone. And the last one is androgen, that leading to hyperandrogen. Exclude the disorders that mimic PCOS like pregnancy, medications, thyroid disease, hyperprolactinemia, non-classic congenital adrenal hyperplasia, androgen secreting tumors, and outflow tract obstruction, that is amenorrhea. Do not mimic these conditions. And at the end of the video, I will tell you the main reason for PCOS and the main leading cause of PCOS that increases the symptoms like hirsutism, weight gain, and irregular periods. The reason behind is only. Now come to the diagnostic criteria, that is first one is menstrual irregularity or oligomenorrhea, then hyperandrogenism. Third one is polycystic ovaries, that we can find out through and we require 2 or more for diagnosis. If there is presence of 2 or more, now come to the treatment methods that we have to. First and most important is lifestyle modification. You have to control your diet and would be very calorie restrictive, and exercise. Exercise is the most and key component of PCOS treatment. And if you smoke, then please do. Improvement in menstrual cycles and hirsutism will decrease through exercise and diet restriction. Use of contraceptive medications. It will help treating the menstrual irregularities, acne, hirsutism, and it will reduce risk of endometrial cancer. And to treat hyperandrogenism, you have to take finasteride. Finasteride, spironolactone, eflornithine cream, and gonadotropin agonist. And for associated conditions, use metformin. Treat especially type 2 diabetes patients. And improves insulin sensitivity and glucose tolerance. It can help regulate menstrual cycles For women who want to get pregnant and facing the issue of infertility, you must have clomiphene and letrozole. And this slide is for educational purpose only. Consult your endocrinologist for medical advice. And the adjuvant treatment is and stop metformin